The government has recognised a problem with benefit spending in Britain. Yes, the amount that is being spent on keeping people out of work has been rising and rising and rising. Not necessarily the unemployment benefits, which of course you need to prove that you're looking for work to obtain, but the out-of-work benefits for other issues, particularly for disabilities, both physical and mental, that have been rising and rising and rising. My name's Tom Harwood and this is GBN Originals. Now, the government is looking at graphs that are flashing red in the Department for Work and Pensions. Clearly, we are seeing a precipitous rise in the number of people out of work and not looking for work. People out of work for all sorts of reasons that range from ADHD to anxiety. The question is, are all of these conditions ones that mean you simply can't work at all? There's an increasing body of science that suggests that actually one of the worst things to do to someone with mental health problems is to keep them at home, is to give them that sick note, is to say, don't come into work, stay in bed. That can, in so many ways, make that mental health problem worse. The severance of routine, the inability of people to go out, socialise, or indeed touch grass, that can make people spiral into worse and worse conditions. So there is clearly a very compassionate argument from DWP Secretary Liz Kendall that actually we've got a perverse incentive structure to our disability benefit system as it currently stands. Are we in effect making people worse off by keeping them at home, not giving them a work element of their plan? This is where the DWP runs up against the backbenchers in the Labour Party, however. There is an almighty row brewing between the Secretary of State and the backbench Labour MPs. There have been ideas floated in the press, for example, freezing personal independence payments, perhaps making the eligibility criteria a little bit more tough, having more discerning nature of whether or not someone deserves that money, whether or not someone could perhaps have a more halfway house, whether someone would be better off in work or out of work. All of these questions being asked by the Department for Work and Pensions, but clearly there is a brewing rebellion on the backbenches of the Labour Party, and perhaps the full-throttled plans as they were originally cooked up by Liz Kendall might not ever see the light of day. The government, whilst it has an enormous majority, in some ways also feels fragile. Their majority has been described as very, very wide, but very, very thin. Don't forget, they won this historic majority last year on 33% of the vote. Historically low for the historic margin by which they won. Now, this all creates problems, of course, because if MPs are jumpy about their position and receive a lot of angry letters, well, perhaps they're more prone to rebel. And a rebellion is what the government wants to stave off more than anything else. So there's likely negotiations going on as we speak between the Labour Party and the government. Yes, it does sound strange, doesn't it? The government talking to itself, the members of the governing party arguing with the government. Make it make sense. But clearly it always happens. Clearly there's always disagreements. And we facilitated one of those disagreements live on GB News today. Indeed, there are those who argue that there can be no cuts made to how we put forward, particularly disability benefits in this country. We sat down and we looked at some of the examples of some of these disability benefits and, frankly, how they might be being exploited.
Splits are emerging in the Labour Party over the government's plans to restrict some sickness and some disability benefits in an attempt to slash Britain's ballooning welfare bill and try and encourage more adults to return to work.
Yes, ministers are reportedly considering saving around £5 billion, tightening those rules around the personal independence payment. However, if the government were to push this to a vote, there's a significant amount of resistance on the Labour benches, could be a sizable rebellion.
There absolutely is. Well, let's get the thoughts now of general practitioner Professor Sir Sam Everington, OBE. Thank you very much indeed for joining us. What are your initial thoughts about the government's desire to slash this welfare bill? Do you think they're looking in the right areas?
Well, the general principle of encouraging and supporting people to stay and work is absolutely vital. If you take an elderly patient aged 80, put them in a hospital bed for 10 days, they lose 10% of their muscle strength, and it's equivalent to 10 years activity. Well, we're finding the same sort of problems in the younger generation. Just imagine, for example, if I said to you, I'll give you a sick note and you have to stay at home looking at four walls for 7 days. Imagine what that will do to your mental, physical and social health. And if that carries on for weeks, it's an unmitigated disaster in terms of the health of the individual. So the job for us as GPs is absolutely to keep people fit and healthy and in work. And we have social prescribers in our team that very specifically help people to get jobs and to stay in work.
That is such a fascinating perspective from the medical side of things, that actually the programmes that politicians design with, I'm sure, the best of intentions could actually be making people more ill by keeping them at home.
Well, you're entirely right. And the other problem with all of this is we're medicalising everything. So you've got nearly 1 in 5 adults now in England on antidepressants. This is really quite shocking. And there's very little evidence that certainly in mild, let alone moderate depression, that antidepressants help. Actually, we need a lot more solutions and help for individuals. You know, if I have a patient that's depressed, I'm going to be discussing with them their diet, their exercise, the support from their family. Are they spending time in nature? There's very good evidence, for example, that if you spend time in nature, that is fantastic for mild depression. And that might be playing golf, it might be going for a walk down the canal, it could be a whole raft of things. But we have medicalized so many of these things. And there's we're almost creating a culture where there's a pill for everything. And that's not healthy. And you will have seen stories over the last few months, actually, of the side effects of some of these drugs. And by the way, I remind everybody that in the patients over the age of 65, 10 to 20% of them admitted to hospitals are as a result of drug side effects. So we have quite a problem in this country when we just have medicalization of a lot of these illnesses.
As a GP yourself, I mean, so clearly you're very careful about dishing out these types of prescriptions to people who come in saying they're feeling very depressed or anxious and whatever else. But why are so many GPs, for want of a better phrase, trigger happy when it comes to giving out these types of pills?
So one of the problems is that GPs are overwhelmed with work. So there are 30 million consultations every month in general practice. That's the equivalent of half the population of this country. That's extraordinary. And whatever people feel, the truth of the matter is the number of patients being seen since before COVID has gone up by 20%. So there's a massive workload, which really stretches time then for GPs to spend with patients. And that applies also to the sick notes. So 94%, so that's the overwhelming majority of sick notes, are sick notes. They basically say you cannot work because there isn't time put aside to make the assessment of, well, somebody might be able to work from home or do a couple of hours a day. This is really, really important stuff. And from a general practice perspective, it really is about time. Also, the DWP, the workers there, they're overwhelmed, but they'll often say to a patient, well, just go and see your GP and get a sick note. So there's a massive problem throughout the system. And there is a solution in the social prescribers in primary care. There's 4,000 of them in general practice, and they could be upskilled actually to help sort all this problem in the same way
to give these less binary sick notes so that people have a sort of partial work prescription rather than just you've got a sick note, you can't work, you must stay in bed and actually become more ill because of it. So Sam Everington, we're going to have to leave it there, but really, really interesting to get your take on this. Well, what do you make of it? Do you think we are getting that much sicker as a country that we need to spend billions, tens of billions of pounds more on particularly disability benefits, spending ever more on people who are out of work? Is that a sustainable situation for the country, or is it inevitable? Are we simply getting ever more ill? I suggest that perhaps the answer lies more in the former than the latter. Well, what do you make of it? Please do get involved in the conversation in the comments below, and remember to subscribe to the GBN YouTube channel.